tracking the experience people have been having with the COVID-19 pandemic in Trinidad and Tobago, touching a little bit also on other islands in the region. So this conversation is basically just to capture the psychological or mental health impact that the virus and everything that has changed due to the spread of the virus, how that has impacted mental health. So the first question is, from what you've seen, what are some of the major changes that people would have experienced in their lives due to the spread of COVID-19? And what would have been some of the mental health challenges people would have been facing by virtue of experiencing these changes? So like isolation, a lot of people had their income being negatively affected. Yeah.
Okay. Well, that's a very big question.
Yeah.
Uh, there's so many different layers to this experience of the pandemic. And so while there are many effects that are experienced by all of us, we also each have our own unique experience.
Yeah.
And I think that is a very critical issue to identify if we're talking about the impact of the pandemic.
Mm-hmm.
So, you have the obvious ones that you've spoken about in terms of the disruption in routines,
Mm-hmm.
which I think is a very stressful issue, particularly because the pandemic is such a time of uncertainty.
Yeah.
And in a time of uncertainty, we want to have things that are predictable and make us feel that we are in control.
Mm-hmm.
And so with the disruption in the routines, whether it is the work routine or the school routine or even the living routine, it increases that sense of being out of control, of being uncertain, of being at risk and vulnerable.
Mm-hmm.
I think I should back up a bit and say, let me just start with this. We talk about mental health and we think about the mind, but very often folks then automatically go to madness and craziness and behavior that's irrational and out of the norm, when in fact mental health is really about wellness and degrees of wellness.
Yeah.
How well you're coping with life, how well you're managing your day-to-day activities, how well you're managing stressors.
Mm-hmm.
And because it's mental health and we tend to separate that from physical health, but in fact they're very correlated. Our physical health affects our mental health, as we're seeing with the COVID pandemic.
Yeah.
And our mental health affects our physical health. So the mind and body are very closely connected. And I think sometimes we forget that as we look at how we need to cope with the pandemic. So that's one important point.
Yeah.
The second important point is that the mind is really a function of the brain. And I don't want to get too, I'm not a medical doctor, I'm a clinical psychologist, but I think it's really important to keep in mind that our brain has been designed for survival.
Mm-hmm.
The purpose of our brain is to identify what can put us at risk so we can avoid it,
Mm-hmm.
and identify what can help us to survive so we approach it.
Yes.
That's the basic core function of the brain. Avoid and approach. And our nervous system has been designed to support that. So you have, and I'm not going to get too technical, but you have your sympathetic nervous system, which is what jumps into action when you see anything that is stressful.
Yeah.
And it raises your ability to be vigilant and to respond, so the blood flow changes, the muscles, etc.
Mm-hmm.
Now, the parasympathetic nervous system is the one that calms you down.
Yeah.
Rest and reset after you've coped with whatever stressed you.
Mm-hmm.
What is happening with the pandemic at a very basic level is that we're all on.
Yes.
We're on all the time.
Yep.
We're vigilant, we're attending, we're worrying, we're concerned, we're anxious. And that mind-body connection means that we also are going to have the physical symptoms.
Mm-hmm.
The muscle aches, the pains, the stomach problems, the constipation, the diarrhea, the
Yeah.
skin problems, the allergies, all are part of a natural response to stress and to chronic stress.
Yeah. Is that
So the very,
is that a response triggered by the limbic system?
yes, well, it links with the limbic system and in particular the amygdala, because the amygdala is what controls emotion,
Yeah.
which now brings in the second part of it. Our earlier okay, I'm going to use the term that we use a lot in the pandemic, pre-existing condition. And
Mm-hmm.
very often we talk about pre-existing conditions in the context of you have diabetes or hypertension or cardiac issues, and that is a precondition that makes COVID more likely to be harmful to you.
Yeah.
But the other way to look at pre-existing conditions is our life story. Where are we coming from? What are our past traumas? What are our stressors? What are the things that we dream about and have been trying to achieve? And those pre-existing conditions, so to speak, are also what can make or break your response to COVID.
Mm-hmm.
So here you have your brain automatically programmed for approach or avoidance for survival. Except that now you're always on. You
Yeah.
don't get a chance to rest and reset. And for those people who have their own pre-existing conditions, it makes it even worse.
Yeah.
And I'll use a general example. If you are economically challenged and you don't have the resources to cope, then you're going to be even more stressed. You're going to be even more triggered to be looking at how you're going to survive, how you're going to make money, etc.
Yeah.
If you're in an abusive relationship and now you're locked down and you can't get away and you're already traumatized, this is going to make you even more anxious and depressed.
Mm-hmm.
If you've been depressed and you have a genetic predisposition for depression, or you've suffered a lot of grief and loss and you're feeling very down, this is going to make it even worse. And so you're going to have increase in suicidal thoughts and suicidal ideation.
Yeah.
What I'm trying to say is that there's a normal range of responses to stress.
Mm-hmm.
And then when you get into the pandemic dynamic of chronic stress, you're going to get people pushed more and more into the abnormal impact and the abnormal response.
Yeah. Yeah.
And it's going to be emotional, yes. It's also going to be cognitive, which means that people aren't thinking straight. They're worrying a lot. They're getting distracted. They're procrastinating. They're not effective. And what do you see happening there? Well, what you have is organizations and institutions and systems that are made up of individuals who are chronically stressed.
Mm-hmm.
And we're seeing it now as we all complain about banks and internet, etc., and systems aren't working. Well, systems aren't working because systems are made up of people.
Yep.
Now, the systems may have had problems originally, pre-existing conditions, but now they're made up of people who are all stressed and to varying degrees traumatized, and so are not functioning well cognitively, not doing their jobs as well as they could, emotionally stressed as well, so worrying and sad and scared and angry and frustrated.
Yeah.
And then also having physical illnesses. And I don't even mean, as I said, physical illnesses related to COVID directly, but the physical illnesses brought on by the chronic stress that's affecting their mind and their body.
Yeah. Yeah.
So I'm starting from the basics because I'm saying it's natural to be stressed and to be worried and concerned.
Mm-hmm.
However, we're in a state of chronic stress because of the pandemic. And then people who have pre-existing conditions or profiles or issues are going to be triggered even more.
Yes.
So people who are aggressive are going to become even more aggressive because they're frustrated, they're emotional, they're not being able to function economically, and so they're going to take out their aggression, perhaps in criminal acts, etc.
Mm-hmm. Mm-hmm.
So it's that natural response that has become a normal response to an abnormal situation that then can become an abnormal response to an abnormal situation.
Yeah.
If you're following the trend. And then you can have abnormal responses to normal situations.
Mm-hmm.
So you're going to have road rage. You're going to have people who are, fighting and quarreling. People who get extremely upset over simple things. Very
Yeah.
sad, very angry, very depressed, because they're, as you mentioned, their nervous system, their limbic system is off kilter.
Yes.
And so any little thing triggers that. So we're
Yeah.
seeing how a lot of the issues that we're observing in society now as are predictable responses to chronic stress and to the sense of being out of control, of uncertainty, and therefore continued vulnerability that requires you to therefore always be on and always be ready to fight or
Yeah.
flee.
Mm-hmm. Mm-hmm.
All right. So kind of just setting the stage there. I don't know
Yeah.
where you want to go with that, but
Yeah. That was beautifully said. And you actually covered a lot of in that small introduction to the conversation. You touched on a lot of things that I really hoped for us to touch on. Are there any groups of any given Caribbean population that would have felt the impact when it comes to mental health and the I guess the associated reactions that would come with all
yeah.
this?
All right.
Are children? Is there any evidence that indicates that children have been having a harder time? Are women more affected than men? Have you seen evidence of probably even a raise in suicide for any particular group?
All right. So let me just take you back to my first point.
Sweet.
I don't want us to get, let me see how to put this. We need to be very concerned about vulnerable population.
Yeah.
We need to understand the profiles and
Mm-hmm.
understand their experience and understand what their needs are, and then understand what services need to be provided and what self-care needs to be practiced.
Yeah.
So that is very important, and I'll get back to it.
Yeah.
But what I think we should not get lost on is that this thing is affecting all of us.
Yeah.
And
True.
sometimes when we start focusing on the vulnerable groups, people feel, well, I'm not a woman, I'm not a child, I'm not
Yeah.
elderly.
Yeah.
So it kind of diminishes my sense that I could be affected too,
True.
and that I need help, and that I should
Yeah.
seek help, or even that I should be aware
Yes.
of how this thing is affecting me. So I want to make that point because all of us are being affected. All of us need to practice self-care, and all of us need support. So we need to support each other. Having said that, certain groups are more vulnerable,
Yeah.
right?
Mm-hmm.
On a basic level, individuals who don't have resources are going to be most vulnerable. So you're going to have the economically deprived, the people who are having financial challenges, because they're directly affected by the increased cost of living,
Mm-hmm.
the layoffs, the especially for the small business entrepreneurs, etc., who depend on being able to move around and market their products, etc., etc. I'm starting with that because that economic impact is a major trigger.
Mm-hmm.
You need money to survive, and your brain is
Yeah.
going to kick in to make you feel that you have to do something.
Mm-hmm.
And what people end up doing is not always the best,
Yeah.
in the best interest of the society.
Yeah.
So vulnerability because of economic resources are very important. Vulnerable group, population. You mentioned, there are three others that are always mentioned. Children.
Yeah.
Yes, children are particularly stressed. And they're stressed in different ways, of course, because of their own backstory.
Mm-hmm.
So, a child who is from an affluent family will be stressed by the pandemic, but will be experiencing it in a different way.
Yeah. Yeah.
As compared to one from a low-income family. Primary school level child will be experiencing it because of loss of structure, not being able to see their friends. They're seeing the impact the pandemic is having on their household, whether it's the adults, the parents, the stress in the family dynamic. It also is because they don't quite understand what is going on, and they're seeing all of these scary stories, etc., that are making them feel vulnerable.
Yeah.
And at the same time, home does not necessarily feel safe anymore if it used to feel safe. And worse, if home was never a safe space, where home was underprivileged or home had violence or whatever, then those children are going to be even more traumatized.
Mm-hmm. Mm-hmm.
Adolescents have a different story because adolescents now are looking to experiment and take risks and make their own identity and space and get away from adult influence.
Mm-hmm.
And here they are now locked down.
Yeah.
Adolescents want to have affiliation. They want to line with their friends. It's just about the time when they would be hanging out at movie town and on the avenue and everything, and they can't do that.
Yeah.
So that frustration and that anger builds up, and it can be turned inwards and become depression. It can be turned outwards and be anger and frustration and rebellion and risk-taking behavior.
Yeah.
So you go and do the things that make you feel like you're big and bad and you're a big person, but without the intellectual maturity to understand how to keep safe at the same time. So they'll go around and they'll not wear masks and they'll drink and they'll have sex and they'll do whatever needs to be done to make them feel good.
Yeah.
In terms of pleasing themselves, but also feel like they're pushing back against all these constraints, all of these things that are preventing them from being who they are.
Mm-hmm.
So, I mean, you're going to have it affecting different subcategories of the vulnerable population in different ways.
Yeah. Yeah.
Especially depending on their personality, their temperament, and of course their life story, what has happened in their past.
Mm-hmm.
The elderly are a particularly vulnerable group, not just because of their risk for contracting the virus, but because, of course, limitations in their resources.
Yeah.
And not just financial resources, but their ability to take care of themselves and live independently. They're very dependent and therefore will feel even more vulnerable, especially if those around them are now more stressed, have less time to attend to them, to take care of them, etc. They will also be particularly affected because and of course I'm generalizing here, but for many of the elderly, they will also begin to have diminishing cognitive abilities. So they won't really understand what is going on, and all the new data and all the new information and the changing rules and stuff just are overwhelming because they can't process all that information. Those of us who are relatively sentient and stuff, we're confused.
Yeah, exactly.
Much less the young and the old who don't have the frame of reference to manage all of this information and data.
Yeah.
So, yes, women are potentially vulnerable, depending on their life situation.
Yeah.
And of course, we know that women who are economically dependent on men, or women who are in abusive relationships, women who now have to do even more childcare and operate on the domestic sphere because the children are home. Resources are limited. They have to make things stretch more. They may be at home now with male partners who are not accustomed to being at home and not accustomed to playing a role and being asked to do things that they as men have never been asked to do before, or they don't feel competent to do, or they're not interested in doing. And that's a challenge for the men also, but it's also then a challenge for the women who are trying to negotiate new kinds of relationships in the household. And of course, women are expected to be nurturant and caregivers. So whether it is because somebody is ill with COVID, or it's a pre-existing condition, or it's just the dynamics in the household, there's a lot of expectation for women to take care, to be emotionally available, even though they themselves are suffering from the chronic stress. That's affecting everybody. The disabled, those who are differently abled, will have their unique challenges depending on their level of functioning. And I guess the point I want to make there is that when we think of differently abled or disabled or whatever term we want to use,
Mm-hmm.
we often think of people who have a physical handicap.
Yeah.
You know, somebody in a wheelchair or whatever. But we don't often remember the blind, the deaf,
Mm-hmm.
or those who have a mental handicap, who might have a developmental disorder, may have autism, and some of these other psychological dysfunctions that make them particularly vulnerable
Yeah.
and in need of support. So you have that dynamic going on also. And then you have just that big area of folks who are functioning really relatively well. They don't have any, they don't really fit into any category of a vulnerable group, but they are seriously stressed. And they are very often the ones who are functioning at a certain level of society where they're in management positions, supervisory positions, dealing with people and also dealing with policies and programs, etc. And you know, sometimes we forget that those individuals, when they are dysfunctional, have a major multiplier effect in terms of the impact on other people.
Mm-hmm.
You know, we see that a lot.
Yeah.
For example, I'll say, like in disasters, when we respond to hurricanes and volcanoes and stuff, and we do a lot of outreach work to people who need food and drink and electricity, and we forget that the people who are cooking the food and working on the electrical power, etc., and the ones managing them are also stressed.
Yeah.
And when they're not supported, when they don't know how to take care of themselves, it affects the people they're managing and supervising, and has a major trickle-down effect
Yep.
to those who are the customers and the service users.
Yeah. Yeah.
So I think that's, as we talk about the mental health, and as I said at the beginning, moving from thinking of it as you know, psychotic disorders, etc., etc., but thinking about what happens in the workplace and how we are helping all levels of staff cope with this ongoing process of change and uncertainty and vulnerability.
Yeah.
And then you come to Christmas.
Yeah, because I mean, a part of the project involved conversations with some of the reporters at Newsday, and some of it are things I think anybody could have assumed, but then there are these subtle details of life that would have changed for people, you know, like fathers who work at Newsday who have to be out interacting with random people covering events, and then they have to go home to their wives and children who normally run to greet them at the door. That can't happen anymore, and kids don't understand that he has to go and wash his hands or even have a shower before he can interact with his children. And you know, those subtleties that still have that kind of impact, a mental health impact, that, you know, in many cases are overlooked.
Yeah, well, that's a whole, that's like a 2-day workshop. But I mean, and that's where it becomes now so important to have that self-awareness.
Yeah.
So we've talked about all these macro dynamics and all of these processes taking place, and you know, it's almost like a turbulent set of water with all kinds of ripples and eddies and all kinds of stuff going on.
Yeah.
But guess what? If we're going to survive, we each have to understand our own personal stories.
Mm-hmm.
And that's where those nuances come in. That's where those decisions and choices have to be made. And those will only be made effectively if we understand ourselves and our situations. And I think, you know, if you're a journalist, as an example, when you're always looking at the story and the bigger picture and the implications, etc., you may sometimes not stop and look at, well, what about me?
Yeah. Yep. Yep.
You'll feel something, you'll empathize maybe, but then in order to get the work done, very often we shut down the personal side, the connection side, so we can be more objective and tell the story.
Mm-hmm.
But we've been triggered, and we carry that stuff home.
Yes.
We carry that stuff around with us.
Yeah.
So, I always included anything I'm talking about the pandemic and self-care. A model that I use with my patients and clients, which is to say, listen, if we're going to cope, we need to have the information. We need to know what is going on.
Mm-hmm.
We need to know and monitor the facts and figures and protocols, etc., externally. But we also need to know ourselves and know our story of where we are and how these things are affecting us.
Yes.
And to do that, it takes more than knowledge. You have to have awareness.
Mm-hmm.
So that's the second thing. We all have to increase our awareness, both of our circumstances and environment and who is around us and how they're behaving and how it might affect us. But we also have to be aware of how it is affecting us.
Yes.
When our buttons are pushed, when we're triggered, we need to have that awareness in the moment, because maybe there's something you can do in the moment to prevent this from becoming chronic.
Yes.
To prevent it from triggering and feeding our pre-existing condition and pathology.
Mm-hmm.
And so that mindfulness, that awareness in the moment is very important. And then the other thing that I emphasize is insight. And by insight, I mean understanding where the dots are connected.
Yeah.
Even though if you are a journalist and you're doing a story on a children's home or something, and you need to know how this might be affecting you because of your childhood or your children or whatever it is, you need to understand what is it's not just that you are being triggered, but why are you being triggered?
Yeah.
What is it pulling out of you, and how can you manage it? Because if you don't know what is going on, if you're not aware what's affecting you, if you don't have insight into how it is affecting you, you will not necessarily use the right strategies or skills to manage.
Yes.
And I guess the point I'm making here is that, people will come to me, for example, and say, well, I'm under stress, I need to relax, teach me some stress management strategies.
Mm-hmm.
And I will say to them, yes, I can teach you how to breathe deeply or to do muscle relaxation or imagery. But what images should we use?
Yeah.
What muscles need to relax and why? What is your backstory?
Yeah.
And just to give like a tangential example, telling somebody to do muscle relaxation and they must concentrate on the different parts of the body and what it feels like and it's tense and what feels good and what feels bad. That might work for you. But if you are somebody who was physically abused or sexually abused, you're not really in touch with your body. And to tell you to focus on that is just re-traumatizing you.
Yeah.
You follow what I'm saying?
Yeah.
So it's what has to be fit for purpose. And each of us needs to understand our stories, so that we can know what's going on, be aware of what's happening, have insight into why it is happening, and choose the right skills learn the right skills and choose the right strategies to cope.
Yeah.
And then the final part of that, of course, is you have to use opportunities to practice, because you're reprogramming your brain to get right back to basic brain functioning.
Mm-hmm.
And you have a neural pathway that has been developed over years for responding to things in a certain way. If you're going to change it, you have to reprogram. To reprogram, you have to repeat.
Mm-hmm.
So every opportunity you get, you have to do it over and over again. And this is also very important for helping people to cope. It's not going to magically be a switch where you realize what is stressing you and you say two affirmations, and
the
affirmation has to match your story.
Yeah. Yep.
And you have to practice it over and over. If you will have noticed, the acronym is KAISO. K for knowledge, A for awareness, I for insight, S for skills and strategies, and O for opportunity. And I guess where I'm getting to with this now is that we each have a choice to make in each moment of the day about how we're going to respond to things.
Yeah.
And an important thing for us to do in this time of the pandemic is to try to ground ourselves and not maintain this sympathetic, chronic stress, hypervigilance on on mindset.
Yeah. Yeah.
How can we ground ourselves? How can we center ourselves? How can we detach from all that is going on and try to prevent it from being programmed
Overwhelming us.
into our body?
Yeah.
And I don't mean by denial and pretending like everything is all right or
Right.
avoiding.
Yeah. Yeah.
Those work in some places and at the
Yeah.
right time. But it really is more about understanding your story, your mind, your body, and making it a part of your routine to take care of yourself the way you need to be taken care of. And also, of course, it's about the relationships you are in.
Yeah, because that when you said that, it reminded me of something that that often crossed my mind since the spread of the pandemic. I've always wondered how many people now have been experiencing some sort of dissociative disorder, whether it's that they've created some kind of story as to what's happening now to make themselves feel more comfortable. Have they disassociated altogether based on trauma that they would have experienced? Like you said, people who don't even know how to connect to their body because they went through some kind of trauma,
Right.
physical trauma. Has there been any indication as to dissociative disorders by virtue of what's been happening with COVID-19?
Yes, and I think when I speak to my colleague psychologists, there are many dysfunctions and disorders that are becoming more apparent because, of course, we all have these kinds of issues to some extent.
Yeah. Yep.
Sometimes we use them in subtle and even healthy ways to cope and to manage the day-to-day life. But now people are kind of ramping it up and it's becoming pathological.
Mm-hmm.
So, the various psychological disorders are becoming more noticeable. Obviously, depression is a major one.
Yeah.
And depression, which includes, of course, by definition, depression includes hopelessness and helplessness.
Mm-hmm.
And the pandemic certainly reinforces those kinds of sensibilities in all of us, much less people who are already prone to being depressed.
Yeah.
And because of the hopelessness and helplessness, you will also get an increase in suicidal ideation.
Mm-hmm.
Why bother? I might as well be dead, etc. But which does not necessarily mean suicidal intention.
Yeah.
It is just a reflection of the hopelessness and helplessness. But it can include intention, and so we're seeing more suicidal ideation and suicidal intention across the board, not necessarily in any particular group.
Mm-hmm.
And that is a challenge because it's hard to tell what is ideation and what is intention.
Yeah.
And it requires the proper kind of support and assessment from a professional usually, which means we also have to be aware of the people around us, and when they make comments, not just treat it as not significant.
Mm-hmm.
But it's a fine line to walk between supportive and empathic and not getting paranoid and overreacting to everything that's happening around us.
Yeah.
So yes, there are coping strategies that are becoming unhealthy, and some of them are leading to psychological dysfunction.
Yeah. What are some of the most dominant coping strategies? Because I've also seen articles on things like hard drug abuse, the abuse of hard drugs being on the rise, because people are in isolation for the most part. What are some of the other impacts of COVID-19 that you've seen, where people would have come in for treatment? Yeah.
I mean, again, I'd have to speak to what I've been hearing from colleagues across the region.
Yeah.
But there certainly is an increase in substance use, alcohol, cigarettes, alcohol, marijuana, ganja, and other prescribed medications. So people are using tranquilizers and Valium, but they're also using over-the-counter,
Wow.
medications to help them sleep or to help them relax, etc.
Yeah.
So it's a line between use and abuse.
Mm-hmm.
And we are certainly seeing far more people using and then potentially abusing. But an interesting nuance when you get to it is that my use may be your abuse.
Very true. Yeah. Yeah. So it
So I
differs.
may not be abusing alcohol, but I, after 2 drinks, may become more irritable.
Yeah. Mm-hmm.
And the impact of my irritability on my family or whoever else can end up being abusive or experienced as abuse.
Yeah.
My smoking a spliff may not be abuse. It's only 1 spliff. It's 1 day.
Mm-hmm.
But when I smoke the spliff, I go home and I just veg out and I don't pay attention to the children or the things that I should have done in the house, whether I'm a woman or a man.
Mm-hmm.
And then neglect is a form of abuse.
Yeah.
So I think that we have, again, if you notice, I keep coming back to the more nuanced and away from the more overt issues. Yeah, people talk about too much smoking and the drunk and the driving drunk and stuff. Those are major issues.
Yeah.
But sometimes we don't pay attention to the fact that on a minor note, without my use being abusive, I could end up being abusive because of my use.
Yeah. Yeah. Yeah.
Right?
Totally understand.
All
So looking at it from that angle of the extremities can, as you said, make people who aren't at that extent feel as if, well, this doesn't apply to me, or I don't need to pay as much attention to the conversation in that regard because I'm not at that place.
Exactly.
Yeah.
Exactly. Yeah. And it also means that we therefore don't take care of ourselves or even take care of the people around us. Because we say, oh, daddy comes home and he's kind of tipsy after work, but he's not drunk like Uncle Mike.
Yeah.
Or like the man on the street.
Mm-hmm.
But when daddy comes home like a tipsy and has to go straight to bed or doesn't have time to play or turns on the TV to watch a sports channel without thinking that, oh yeah, I didn't talk to the kids because his head is not straight. That's problematic.
Yeah.
Yeah. And it has that ripple effect.
Yeah. Yeah.
No, let me just make sure that, I'm not ignoring the issue of alcohol abuse and its impact, the aggressive behavior, the drunk driving, etc. I'm not ignoring the issue of the increase in other substances, whether it's cocaine or the various pills, etc., that young people are experimenting with, for example, which are serious problems and which many adults and parents don't even understand about. They don't know what is being used. And I'll give you another example, pornography.
Yeah.
Which is something that many of us use just, casually, periodically, or whatever, or maybe not at all. That use has increased dramatically.
Yeah.
Because it is people are locked down, they cannot get their sexual urges satisfied, or they're locked down and don't have anything else to do, so it's something to do. And of course, because of the physiological effect of the masturbation, etc., it's relaxing. So it becomes on the one hand a stimulant and a distraction, and on the other hand a soothing anti-anxiety release.
Yeah. Yeah.
And because it is forbidden, it also gives you that feeling that you're doing something and you're getting away with it. And, which works particularly well for young people.
Yeah.
So you have that whole dimension of the impact of that now on people's feelings of guilt, if they have religious beliefs or moral issues, the effect it has on relationships, the fact that it's not discussed. and therefore it's something that is under the surface causing problems potentially.
Yeah.
Gaming is a major issue with young people.
Wow.
They, many parents don't even understand what is going on behind the closed doors of their adolescents and adults. I mean, gaming is not, as you know, gaming is not just
Yep.
with youth.
Yep.
It's a major distract. It serves that same purpose. It distracts you. It focuses you. It gives you a sense of
Yeah.
competence. It gives you a sense of self-esteem. You're
Mm-hmm.
competing. You're interacting.
And it removes you from this world of confusion that
It,
you're trying to
it,
figure out.
that's right. And you can be in control. And you can predict what's happening. And it's a safe space. And
Mm-hmm.
all those things happening, which are not in and of themselves pathological, but when you put that in the context of having a balanced life, having an outdoor life,
Mm-hmm.
eating properly, socializing, having a spiritual life, having physical exercise, etc., it really doesn't bode well when that's what's going on. And then
Yes.
again, many people game between midnight and 4 and 5 in the morning.
Mm-hmm.
Because
Mm-hmm.
there's nobody to distract them and ask them to do anything, and therefore, no, they haven't slept. It changes their whole body clock
Yeah.
cycle.
Mm-hmm.
It affects their productivity during the day if they are supposed to be productive. These are all the many different dimensions of how people are being affected by the pandemic that go beyond the actual physical effects.
Yeah. Yeah.
These are the psychosocial dynamics that we need to talk about, and we need to talk about them as I said, not only in the extreme,
Mm-hmm.
but in the personal, the nuance.
Yeah. Yeah. Because I feel like I haven't seen as much conversation talking about the nuance, the smaller, the more subtle impacts. A lot of the time I'll come across articles talking about mental health impacts of COVID, and they really do tend to focus on the extremities. So I'm really happy we're touching on a lot of the more subtle effects that can snowball, that could have people feeling as if, yeah, this doesn't apply to me. So I really appreciate that you sent the conversation in this direction with a little more intention.
Well, I thought about it when after you asked me yesterday, and I said, let me, what can I say that's not usually said? What
Yeah.
can I focus on? Because I think that we do need to have these as parts of, and this is where journalists can play a major role, because
Mm-hmm.
you now can put that in the contemporary cultural context. So let me just make this last one. As a Jamaican living in Trinidad
Yeah.
for 12 years, it struck me right away, and it became even more interesting to me how little attention is paid to the impact of cultural diversity.
Yes. Yeah.
And so everything I've said, while it might apply generally to Hindu, Christian, Shouter Baptist, Rasta, French Creole, Asian, Venezuelan, Afro, Indo, within each of those groups now, all of this is going to play a little differently.
Yes. Yeah.
And unfortunately, but I just say it, unfortunately, I find that Trinidadians are so afraid of acknowledging their diversity and the challenges of the diversity.
Yeah.
They very comfortable talking about the creativity and the beauty and the Ganges meet the Nile and that part, yeah. But then when you talk about when I first moved to Trinidad, our neighbors who were Indian brought us some sweets at Diwali. And when we told some Trinidadian, Afro-Trinidadian friends that we had the sweets and eaten them, they said, "What?
Yep.
You know, they pray over it and they
Yeah.
put all evil spirits into it." And we
Yep.
said, "What are you talking about?"
Yep. I had that experience too.
So I'm using that. It's a very tangential example, but there is there is an avoidance of an interrogation of the impact of the diversity on how people respond to, how they're affected by, how they cope with life's challenges, and in this particular case, the pandemic.
Yeah.
You know, it's like don't look there because you might see something that you don't want to
Yep.
find out, or don't talk about it because you might say something that gets in trouble, that causes a problem. So it's like a conspiracy of superficiality.
Yeah.
Is
Yep.
what I do.
Yep. Yep.
And so again, as journalists, I think there is an important role that can be played in trying to begin to interrogate without judgment, but just, you know, and that's very hard to do because anything you say to people when they say you judge it.
Yep. Yeah. Very.
If you're Afro and you're writing about Hindu, you're biased. If you're Hindu, you write about Afro, you're biased.
Yep.
I understand that. That's why people stay superficial.
Yeah.
But at some point, some of us have to kind of take a deeper dive and say, okay, what are the unique challenges for Hindus,
Yeah.
Muslims,
Mm-hmm.
you know, Catholics? Is there something in there that is, and I guess part of why I think that is so important is that each of those cultural identities, for want of a better word, will bring strength.
Yes.
You know, so it's not a one-size-fits-all message. You know, when you're talking about wearing the mask and hygiene and protection, the message you give to a 14-year-old male is different from a 30-year-old male, from a 60-year-old female. And it may be different for a Hindu. It may be different for a Hindu, a Muslim, a French Creole.
Yeah.
But, you know, depending on the economic status, etc., etc. To me, this has been one of the weaknesses of our regional response to COVID, in that our prevention messages have too often not been targeted. They've been very generic.
Generic and generalized.
Very generalized, and only now are you seeing a lot of ads that are kind of a little more personal and having a little more of a target. But if you're going to change behavior, you have to understand what contributes to behavior, and the mindset and the culture are major factors in what people do and what they do and why they do it.
Yeah.
So I'm making this point kind of at length, but because as we talk about looking at all the nuances, there are these cultural, racial, religious nuances that also need to be considered.
Yeah. That's something I didn't even think about too much. But yeah, in this conversation, I'm realizing how diverse the range of experiences are, and all the tiny details that can impact people in so many different ways.
But
When
they
you
look tiny
consider,
from outside.
yeah,
But when you realize it's not tiny.
when you consider people who, they live in a traditional living, a family setting where many family members live in the same household, and how do you social distance, and if you have to social distance, what psychological impact does this have on a family that's normally very close knit, for support in so many ways beyond
Exactly.
economic? Yeah.
So one of the hypotheses is that one of the reasons why it is spreading so rapidly in Trinidad is the multi-generational households.
Yeah.
It is that you have children and adolescents and young adults living with adults and elderly, all in the same compound, with the different lifestyles all meeting together and bringing in all that they can bring in from outside, including the virus.
Yeah.
But if you're going to change it, you can't just, it's not as simple as saying, well, don't go near granny.
Mm-hmm.
How are you not going to go near granny if you're sharing a bedroom with granny?
Yeah. Yep.
Or if you have
Yep.
to feed granny because there's nobody else to feed her and she can't feed herself.
Yeah. Yep.
Um, it's really, really very, very challenging.
Yeah. It's quite complex. It's more complex than the conversation normally acknowledges. Yeah.
Yeah, and I think the point you picked up on earlier is a critical point, which is that, again, to go back to the Kaiser model, we know a lot of this stuff, but it's our personal awareness and insight that can lead to using the right strategies to change.
Mm-hmm.
And if you can't personalize it, if you can't relate to it, if you can't see yourselves in it, then it becomes a story.
Yeah.
Something you're watching on CNN.
Mm-hmm.
It's what's happening in New York.
Mm-hmm.
It's South Africa. It's Bangladesh or Mumbai or wherever. But to make it feel like us, it has to look like us.
Yeah. Yep. So for
And
people, So for people who feel these changes and they might not be sure how to process it, and then even for people who can to some extent process it, what are some other resources available to them that they might not be aware of that they could use to help them cope better and find a greater level of balance to make it through this very rare period in our experience?
All right, so there are a number of different responses to that. I'll give you two that come to my mind first. The first one gets back to, it's all about the mind, it's all about the brain, it's all about the body. And because people don't know and understand how the mind and the body are interact, they don't understand well. I'm going to change how I'm saying this. You ask how to help people in this time.
Mm-hmm.
One way people can help themselves is to understand how to take care of themselves.
Mm-hmm.
To understand how to take care of themselves, they need to understand that whole mind-body link. They need to understand that things that they have always done but took for granted worked because of that mind-body thing. So when you pray,
Mm-hmm.
when you meditate, which many people have always done, what you're doing is reprogramming your mind away from the day-to-day hustle, focusing, letting go, relaxing, all of those things that the psychologist or counselor will tell you are part of deep breathing, muscle relaxation, etc. So people kind of do these things already, but they don't understand what the process is, and they don't understand that they can use that same strategy in other aspects of their life.
Yeah.
So I think a critical thing that needs to happen is that people need to understand that in the same way that when you pray or you meditate or you say your psalms or whatever it is, in the same way that when you exercise and your body gets into a routine and you get into a flow, whether you're sweating on the savannah or you're in the gym, the reason those things have always worked and made you feel good is because they're triggering a certain physiological response, psychophysiological response, if you want to use that term.
Yeah.
Which you can get by doing other things.
Yep. Yeah.
And it is important to do that because you have to break that chronic stress cycle and not escalate it and let it just escalate by itself.
Yeah.
Now, when people understand that, and they understand that they may not see the immediate benefit of what they're doing, it's not going to be an aha moment or a light goes off or the stress just flows away from them. It's something you're doing the same way like you clean your teeth.
Mm-hmm.
You clean your teeth because you don't want to have cavities. And if you don't clean your teeth, you're going to get decay and cavities. Your prevention, it's part of, you don't bathe in case somebody smells you. You bathe because you're trying to keep your body clean.
Yeah.
And you're not necessarily seeing the benefit right away. So if we can shift the mindset so that people understand why this kind of basic self-care, it's something that's not strange or new, it's not magical, it's part of what they've done as part of their life, but now they're going to do it more intentionally.
Mm-hmm.
And they're going to do it in such a way that they understand that they may not feel the immediate benefit, but it is changing their body and their mind and making it less likely that they will suffer from chronic stress that will then trigger their pre-existing conditions and make their life more stressful and challenging.
Yes.
So there's that level of understanding. And they, you talked about the limbic system, and if they can understand that, they will have competing dissonant thoughts and feelings that will tell them, don't bother, it don't make sense, don't try, you're not good, you didn't do it yesterday, so it don't make sense doing it again today. They understand how to use their self-talk.
Yes.
To work their way through all of that negative, thinking and emotion that might keep them from doing what they know they should do.
Mm-hmm.
So you follow what I'm saying? They know, but if they lack that awareness and insight, then things will prevent them from just doing some of the basic things that can make a big difference.
Yeah. Yep.
So that's one level that I think we really need to explore more. And as I said, it's not magical. People know that they feel good when they pray and they sing a psalm, and they know that they feel good when they have exercise and sweat. But this other stuff gets in the way of intentionally and mindfully making it a part of their daily self-care.
Yeah.
And by the way, just to mention, there are many dimensions of wellness.
Yes.
And sometimes we don't integrate the fact that there's the interpersonal, the cognitive, the emotional, the physical, the spiritual, and the professional.
Yeah.
And so that's another thing that people need to think of, thinking of themselves as having these different dimensions and always trying to keep them in balance.
Yeah.
All right, so there's that wellness approach. And of course, it means seeking help in each of these areas, whether you're talking to your imam or your pastor, or your Bible study group for the spiritual, whether you're liming with your friends virtually for the social, whether you're managing how your mind is being stressed and you're doing physical relaxation, whatever it is.
Mm-hmm.
We all need to have a kind of game plan for our wellness.
Yeah.
And always be monitoring it and managing it. Now, so that's at one level. And at the other level, there are lots of resources out there. I mean, that's the beauty of the virtual world now.
Yeah, absolutely.
Everything is online. But you have to be motivated to seek it and understand why and what is useful to you.
Yeah.
Find Care TT. I don't know if you're aware of it, but it's a website run by Mindwise. Maria O'Brien.
Mm-hmm.
And Find Care TT is a repository of all the free services available in Trinidad. All the hotlines, all the clinics, all the wellness centers, all the substance abuse services, all the parenting services, all the child services, etc., etc.
Yeah.
Right there online. It's relatively new, so it's only just been promoted over the last few months during the pandemic.
Yeah.
But people have to see it as relevant to them.
Mm-hmm.
Again, if you haven't personalized this, if you don't think, gosh, yeah, maybe I should find out about X or Y, then you won't think of going there.
Yeah.
And this is a whole nother nuance, you can do it to help other people. So you may not have a problem, but if you see John or Mary or your cousin or your auntie or your co-worker and there's an issue, you can refer them to that service or any of the others, or you could go online and check it out yourself to figure out how you can help them or what information you can give them.
Yeah. Yep.
So it's a collective response as well that we need to promote.
Yeah. Beautifully
It's
said.
a very challenging time. There's no one size fits all.
No.
And I think that we each have a certain amount of personal responsibility to understand ourselves and the people around us and understand how complex this thing is, but also understand that sometimes there's some straightforward and simple responses that can be a foundation for the more difficult responses you're going to have to, strategies you're going to have to use down the road.
Yeah.
We have to set the stage. This thing isn't going away. It's just going to become more complex, not necessarily more, terribly complex, but just that it's going to have more and more nuances.
Yeah. Yep.
We're going to have to learn to live with all the different variants and the different medications and injections and the changes in the way we interact with each other. And it's going to be a moving target, and we're just going to have to keep moving with it, but also every so often pausing and resting and recalibrating and restoring.
Yeah.
But you have to have that balance.
Yep. Sweet. All right. Well, I think that definitely takes us to the end of the conversation. Is there anything that you wish I would have asked that I probably didn't ask that you'd like to provide some information on?
I touched on, but and without, I'm not saying we need to go into it now, but the issue of spirituality and religious beliefs and the influence and powerful impact of faith leaders, spiritual leaders, I think is also something that needs to be understood.
Yeah.
Because virtually every religious belief will have contradictory messages.
Yeah.
Messages that seem to be contradictory. And again, it is about unpacking some of those nuances and ensuring that the influential, those leaders who are powerful in their messaging, are not causing problems.
Yeah. Yeah.
Because, we tend to follow our leaders, especially when it is an issue of faith. And sometimes we don't step back and objectively look at what the science is telling us.
Yeah.
And unfortunately, we see how that has led to problems all around the world.
Yeah.
So the faith leaders need to be our friends in this process. And we need to find out where in their faith is that common position, that those points of reference that can be really helpful and productive, and rather than dissonant and disruptive.
Yeah. Yep. Yeah.
So that's another whole area of
Yeah.
investigation.
Yeah.